Greetings, this is your health coach Annie. Welcome back to my platform. And please don't forget to follow my health and well-being on all social media platforms. In today's video, I want to talk to you about a disease called lupus. Lupus is an autoimmune disease in which the immune system attacks its own normal cells. The skin and joints are most commonly affected, but any part of the body can be affected. Lupus can cause many different symptoms, including fever, fatigue, skin rashes, body aches, and confusion. While there is no cure, symptoms can be managed with medication and diet and lifestyle changes. Lupus can be difficult to diagnose as the signs and symptoms are often similar to those of other diseases. The most prominent sign of lupus, a rash on the face that resembles the wings of a butterfly, unfurling across both cheeks, occurs in many, but not all, cases of lupus. I know that this disease is new to some people, or they may never heard of it. Now, let's look at the symptoms of lupus. No two cases of lupus are the same. The signs and symptoms can appear suddenly or develop slowly. They can be mild or severe, and they can be temporary or permanent. Most people with lupus have a mild disease course characterized by episodes called flares, in which signs and symptoms worsen for a time, then get better or even disappear altogether for a period of time. The signs and symptoms of lupus that you experience will depend on which body systems are affected by the disease. The most common signs and symptoms are fatigue, fever, joint pain, stiffness and swelling, butterfly shaped rash on the face that covers the cheeks and bridge of the nose, or rashes elsewhere on the body. Skin lesions that appear or worsen with sun exposure, fingers and toes that turn white or blue when exposed to cold or during stressful periods, shortness of breath, chest pain, dry eyes, headaches, confusion, and memory loss. In case you want to check whether you have lupus, there are a lot of possible symptoms of lupus. The main symptoms include joint and muscle pain, extreme tiredness that will not go away no matter how much you rest, rashes that usually come on after being in the sun. The rash is often over the nose and cheeks. You might also have headaches, mouth ulcers, a high temperature, hair loss, weight loss, swollen glands, usually in the neck, armpit or groin, depression and anxiety, chest or tummy pain, changes in the color of your fingers and toes when you have cold, anxious or stressed. Let us also look at the symptoms of flare-ups. Lupus often flare-ups or relapses and symptoms become worse for a few weeks, sometimes longer. Symptoms then settle down. The reason why symptoms flare up or settle down is not known. Some people do not notice any difference and their symptoms are constant. In case you are wondering what causes this disease, as I have already mentioned, lupus is an autoimmune disease that occurs when your immune system attacks healthy tissue in your body. It is likely that lupus is caused by a combination of your genes and environment. It seems that people with an inherited predisposition to lupus can develop the disease if they come into contact with something in the environment that can trigger lupus. In most cases, however, the case of lupus is unknown. Some possible triggers are number one, sunlight. Exposure to the sun may bring on lupus skin lesions or trigger an internal response in susceptible people. Another one is infections. Having an infection can initiate lupus or cause a relapse in some people. The other one is medications. Lupus can be triggered by certain types of blood pressure medications, anti-seizure medications, and antibiotics. People who have drug-induced lupus usually get better when they stop taking the medication. Rarely, symptoms may persist even after the drug is stopped. Let us also look at the possible risk factors. Factors that may increase your risk of lupus include your sex. Lupus is more common in women. Number two, age. Although lupus affects people of all ages, it's most often diagnosed between the ages of 15 and 45. Another factor is race. Lupus is more common in African Americans, Hispanics, and Asian Americans. If you're wondering whether lupus can be prevented, my answer is you can't necessarily prevent lupus, but you can avoid the factors that trigger your symptoms. You can, for example, number one, limit your time in direct sunlight. If sun exposure causes a rash, you should always wear a sunscreen with an SPF of 70 or higher that blocks both UVA and UVB rays. Number two, Try to avoid medications if feasible that make you even more sensitive to the sun. Medicines like sulfur drugs, tetracycline drugs, and antibiotics. Other one is develop management techniques, meditate, practice yoga, or get massages. Whatever helps calm your mind. The other one is stay away from people who are sick with colds and other infections. The other one is get enough sleep. Go to bed early enough each night to guarantee yourself 7 to 9 hours of rest. Another one is quitting smoking. Smoking trigger lupus flares. If you smoke cigarettes, try to quit smoking or speak to your provider about ways to reduce your tobacco intake. And my final one is limiting exposure to toxins. Look for household products that do not contain silica dust. If you're around people who smoke, secondhand smoke can also trigger a flare up. Try your best to find an environment that limits your exposure to secondhand smoke, or request your friends and family to not smoke in your home or car. It is no secret that the choices we make can have an impact on our health. So please take good care of yourself. I hope you will put into practice all the tips I have given you to avoid the factors that trigger your symptoms. If you have any health concerns, please consult your doctor. If you have any questions or comments, feel free to leave them below. Thank you and hey, bye.